A Melbourne, Florida-based company called PhyTech, also known as Physician Technologies, provides hospitals, clinics, and physician practices with affordable, effective, and easy-to-use digital tools to address their need for more intuitive and efficient technology solutions.
I practice interventional cardiology in two of the local hospitals at Woodstock and Holmes Regional Medical Center in Melbourne. I've been in practice for the last 22 years, mainly doing interventional cardiology, nuclear cardiology, and clinical practice. I got involved with PhyTech because I think we're bringing to the community some different products, some definite improvement in what we have.
What began as a concept devised by physicians to drive improved productivity and quality in patient care has evolved into the creation of multiple solutions for physicians to improve the ways in which they provide patient care. Today, PhyTech is a medical software vendor that provides physician-centric solutions to hospitals, clinics, and physician practices.
Ideas come out of something else. So like I had an idea when I was looking at the stock market one day, and looking at this guy trying to make a decision about whether to buy or sell a stock. And he had like 8 different screens, and he was telling all these numbers going up and numbers coming down, the gold prices and oil prices, I remember. And I said, wow, for him to make a buy and sell decision, he has 8 different screens telling him what's going on in the world around him. And yet we as physicians look at one screen after the other and come up with an answer. Why can't we have different screens?
PhyTech believes the key to successful implementation of any solution is aligning people and processes with technology. The results are improved quality of patient care and performance.
Well, we physicians have been the last one to embrace electronic medical records or anything electronic. If you think of it, we're still in the ages of chart records, and we're still handwriting our notes, and we really have been quite reluctant. In fact, the IT department of the hospital says, so that we have a good product, how would you have the physicians buy into that? Because the physician buy into these electronic products have been really, really poor. And I hope that gradually, since we get used to these electronic products that we use in our daily lives, our computers, our emails, our iPhones, I think will help us go forward in the new era of electronic medical records.
PhyTech's mission is to deliver innovative physician-driven applications, solutions, and services, improve patient care by enabling improved quality information for physicians, and maximize doctor-patient time by improving physician productivity.
Well, I would recommend all medical practitioners, IT people at the hospital, administrators at the hospital, to look at these products very seriously because they're different. They do reduce errors. They help physician practice better. They standardize care. And I think the scheduling product, the reporting product, and ultimately the electronic health records will make us physicians more knowledgeable about patient care. And we'll definitely be able to deliver our patient care in a much more concise way and error-free rate. So that would be better for physicians and better for patient care.
PhyTech offers 3 digital tools: cardiology reporting, on-call physician and clinical scheduling, and the provider portal. The cardiology reporting application allows physicians to automate and streamline their reporting workflow by electronic reporting of non-invasive cardiac procedures including echocardiography, regular stress, nuclear stress plus thallium, nuclear dipyridamole plus thallium, nuclear lexiscan plus thallium, carotid ultrasound, and vascular ultrasound.
The medical reporting and cardiac reporting took us a few months to put together, but once it was put together, the staff really loved it because it was right away they got the reports. The referring physicians and the primary care physicians liked it because we had the reports the next day. The standardization of all the different parts of a report became very important, and so it's really helped us.
The on-call physician and clinician scheduling application is an intelligent web-based solution that makes creating, organizing, and maintaining schedules effortless. It allows physicians and clinicians more control by providing real-time access to view and dictate schedule changes anytime, anywhere.
This would help physicians schedule their time that they want to be on, the time they want to be off, and also we're developing a mobile product so that when they're in Orlando or they're in Miami and they want to change a call, give away a call, they can do that without being present here, without making 15 phone calls, without spending time to just doing something really mundane.
Its key features are rule-based automated scheduling, web access from anywhere, real-time updates and notification alerts with mobile application, consolidated hospital-wide call schedules, scalable solution that can work for a single department up to a multi-location hospital network, and provides intuitive clinical resolution to drive efficiency throughout on-call and clinical scheduling functions.
So it'll help me change my call, swap my call, and the mobility it will give me is really going to help me.
Without having to flip multiple tabs and sources of patient information, the PhyTech Provider Portal gives the physician an easy-to-read, multi-screen view of patient data, all in one location.
The first screen is a problem list patient, so that when the patient comes in, he has got multiple problems. He's got a headache, he's got chest pain, he bled from his groin or has peptic ulcer disease, or prostate cancer. So what are the active problems that are being taken care of by the physician? The second screen is more about the history and physical that the physician took, the consults that are being dictated. So it's a rolling numbers. You can see what the H&P was, how the consults were written, what's going on with the patient. The third screen has multiple parts to it, but most importantly, it'll give you the vital signs, what's the blood pressure, the heart rate, the pulse, the temperature of the patient. Apart from that, it'll tell me on a daily basis what medicines the patient is on. And the fourth screen is about what procedures are planned and what procedures have been done.
The portal automatically gathers data from the labs, from electronic medical records, from notes and other ancillary systems, allowing the physician to view the information easily and efficiently, all the while reconciling and organizing the information to save time when the patient is discharged.
So in one sweep, I will know what are the active things that I need to look for, what the other physician have done for him, what medicines have affected him, have they been changed, and what are the procedures to further evaluate this patient and diagnose this problem. So I think in a sweep, you would know much better about the patient.
PhyTech's innovative and highly talented team has created some brilliant digital tools to help physicians save time, money, and provide better patient care. In the ever-evolving medical environment, PhyTech is an industry leader in helping physicians in hospitals and clinicians find an affordable path to improve productivity and quality in patient care.
The most important thing I would like to tell my colleagues would be to give it a try. See how easy it is to use, how easy it makes the life for the physician. Because at the end of the day, our electronic medical records or electronics should not make us slaves, but we should be able to control that and make our lives easier.